All right, now we are going to talk about pre-labor. And one important thing to note right off the bat is not everybody experiences pre-labor. So your first signs of labor may be early stage 1 labor. But a big part of the population is going to experience what's called pre-labor. And the purpose of this is just starting to get your body ready. So you may be having contractions that are light and sporadic, and they're helping to tone the uterus. They're also helping to prepare the cervix to soften and thin so that once labor begins, it's able to open or dilate. And the big thing that makes pre-labor different from early stage 1 labor is that your contractions are not progressive in pre-labor. So they may come for a period of minutes and then they might leave for hours and then return again, and they're not necessarily getting more intense and progressive in that way either. So that's the big difference between pre-labor and early stage 1 labor. So what are you going to do when you start to experience these pre-labor sensations? The best thing that you can do is recognize that this might be a pattern that happens over the course of days. And so getting really excited and timing those first contractions really intently may not serve you the best. So you may want to just try to continue on about your day, rest when you're able, eat when you're hungry, drink when you're thirsty. Maybe you're going to go for a walk or do some light gardening. Just different things that are going to help you maintain some normalcy so you don't get overly eager and excited. And it really just helps to have this combination of rest and activity to help labor then progress to early stage 1. So, considering that not everybody is going to experience these pre-labor sensations, it seems like a good time to talk about timing of contractions, because occasionally you are going to want to time these contractions to be able to determine if they're progressive or not progressive. Okay, so again, you don't need to time every contraction. Realize this might be a pattern that happens over the course of days, and it's going to be very draining if you're timing everything. But timing occasionally to determine if things are progressive or not may make sense. So you're going to time the contraction, and you're going to also time the period between contractions, and you're going to keep an eye on the length of time that this pattern has been consistent for. Okay, so if any number of those seem to be progressing, then you can kind of make the mental note that you're in early labor instead of pre-labor. So if the contractions get more intense, longer, there's shorter intervals between contractions, those are all things that will help you determine that you're now in early stage 1 labor. One thing that may happen in pre-labor, or it may not happen until several stages down the road, is that your water may break. And so this could happen in a really slow trickle that you're barely aware of, or it could happen in a really obvious gush. So just to be aware that this could happen at any stage, and your water breaking doesn't necessarily indicate that you are in a progressive active labor state. So we have talked about pre-labor. Now we're going to move into talking about early labor, and then active labor, and then stage 2 of labor, which is the pushing stage. And the timeline can get kind of confusing because sometimes the edges or the boundaries are a little bit fuzzy. So the important thing is that you have an understanding of what you need to do at roughly each stage, and that you have good communication with your care team as to what that's going to look like.